in flu cases that's placing a massive strain on our region's NHS.
Yes, flu rises at this time of year, but this time experts say the figures for this winter are very worrying, not just for those suffering with it, but also our hospitals and GP services.
Yeah, the latest figures we have show hospital admissions for flu increased almost 30% just last week. In real terms, that amounted to more than 1,100 patients with flu in hospital, up from 825 in the previous week.
But vaccination rates for flu are falling. The latest data shows fewer eligible people have had the flu vaccine this year compared to last, with just under 28% of people under the age of 65 and deemed to be clinically at risk vaccinated. As of the 5th of this month, 2 million flu vaccinations had been administered in the northwest since the beginning of the autumn campaign in October.
But the message is there are still thousands more jabs available, and vaccinations can be booked online before the deadline of December the 19th.
Well, who better to talk about this than Dr. Helen Wall, who's a GP and the Clinical Director of Population Health for Greater Manchester. Helen, always good to see you. Firstly, what is going on here? Why are vaccination rates for flu falling?
I think it's a multifactorial picture here, and we've talked about this many times before about all the different vaccination programmes are all on a downward trajectory, unfortunately. Flu this year we've seen a fairly good uptake for our over 65-year-olds, our elderly population, but still around sort of the 70-odd% mark, so still some way to go to give full protection. But as you mentioned, it's the younger people who are not coming forwards for this vaccination. 28% is woeful, really, and it's really quite worrying, because if you are eligible for the flu vaccination, you're free on the NHS, should we say, you're only eligible because you are at risk, you're deemed to be at risk, and we are seeing people going into hospital, not just elderly people, but lots of children. Our flu rates in children, those 5 to 14-year-olds, are high, and we're seeing lots of younger people who would be eligible for the vaccination going into hospital, those with diabetes, asthma, lots of other health conditions, heart conditions, and they're just not being vaccinated, and that is a real shame.
But why is it those younger patients who need it aren't going forward for it?
Well, I think that's a question, we could talk about that all evening. I'm seeing, as a GP, I'm seeing in practice a lot of patients who are describing what we've coined the term vaccine fatigue. I think, we've done a lot of vaccine work over the last few years since COVID, and I think people are tired of hearing about vaccines. I think there's lots of competing priorities. We've got a lot going on in our lives now. We've got a cost of living crisis. We've got a lot of competing pressures on working age people in particular, on everyone, but particularly those of working age. It's just not up there on the priority list. And I think there's also a little bit of complacency as well that's crept in, and we always see that in a cyclical pattern. We see people who perhaps feel they're young, it's not affecting them, they're not at risk. And, I personally have had patients who have been young and in some worrying cases have died from flu. So, really don't want to see that happen again.
So what impact is all of this having on NHS services?
Well, worryingly, we're seeing a much higher much higher numbers of people going into services at this point in winter. So we always see a peak of winter, and that's usually after the Christmas period when we've all been mixing. We've been at carol concerts, nativities, we've been around to people's houses socialising, and we tend to see sort of that beginning of January a rise in cases. But what we've seen this year is even at the start of December, we saw 95% of our hospital beds full, which is a very worrying start to the December festivities. And we're worried that that's going to continue. It's not just our hospitals that are impacted, and they are severely impacted by this, but obviously all the other services. So 111 calls are up. Our ambulance call-outs were the highest in November than any other November on record. Our A&E attendances were extremely high. It's just massive impact.
Yeah. So what would you say to anyone watching this who might want a jab? Maybe they haven't been able to get one at the GP or they're walking. What's your advice?
My advice is to not think that it's time's up, because it isn't. As we've said, the National Booking Service will end this week on the 19th, but the 119 number is still going to remain open for people to call if they want to find out where they could go. After the National Booking Service closes, many GP practices will still be offering flu vaccine and local pharmacies as well, and there will still be COVID vaccines available particularly in pharmacies, still some practices, but it might be a little bit hit and miss for that. But they are still available until the end of January and flu until the end of March.
OK, Helen's clear as ever. Dr Helen Wall, thanks for your time.
Thank you.
Well, next, the boss of East Lancashire Hospital NHS Trust has warned it's running a 26